Welcome to all of you. I am absolutely thrilled to be able to introduce today's speakers, Dr. Jonathan Lai and Dr. Deepa Singal. I'll start with Dr. Lai. Dr. Lai is the Executive Director of Autism Alliance of Canada and also holds an adjunct faculty position in health services research at the Institute of Health Policy, Management, and Evaluation at the Dalla Lana School of Public Health, which is at University of Toronto. Throughout his career, he has worked at the interface of research, community, and policy to effect systems change in the health and social services sector across Canada and internationally. Now I'd like to tell you about Dr. Deepa Singal, who is the Scientific Director at Autism Alliance of Canada, also assistant professor in the Department of Pediatrics at the University of Alberta, and adjunct scientist at Manitoba Centre for Health Policy. Her mission is to drive evidence-based policy development that supports autistic people and advances equity across systems. I'm going to hand it off to Dr. Singal first to begin the presentation.
Thanks so much, Caroline. It's a pleasure to be here, and thank you for everyone for joining and coming to learn with us. Jonathan and I are going to do the very awkward thing where we try to do a co-presentation in two different provinces and two different time zones in front of you all. He's going to control the slides, but I may have to tell him when to advance. You can advance, John. So while today's conversation, discussion, talk isn't about the claims that have come out of the U.S. Administration, we did think that it was important to touch upon the impacts that the last 2 weeks have had on our community. The way that autism was framed, the way that it was spoken about at a really high-profile press conference with the most powerful person in the world was really had a lot of negative consequences on both pregnant women, families, and most importantly, autistic people. Reframing autism as something to be feared or something to be, worried about in that way creates stigma. And this is the stigma that self-advocates have been so brave to speak up against for many, many decades. Many people across the country acknowledge that framing autism in the way that the U.S. did really set the advocacy movement back decades. So we really want to acknowledge that, the stigma that comes out of conversations like this. This isn't just a scientific debate. There's real people behind it, and it actually has serious system consequences and serious health consequences on that community. We know that stigma can delay diagnosis and support. It can create barriers to accessing services. And really importantly, within the context of this conversation, it leads to fear-based policies rather than investments in support and inclusion, and drives further inequities. I really also want to acknowledge the negative consequences it can have on the mental health of autistic people and families. It leads to bullying, leads to feelings of hopelessness and worthlessness. And that's something I know that everyone here today is fighting against and supporting. So just really wanted to bring attention to this important topic. Next slide, John. And focusing on what we're here to do today is to really bring the focus back. Let's bring the focus back of this global rhetoric back to the work that we need to do at home. It's a time where we can reaffirm our national priorities for action. So this talk couldn't have come at more of a timely manner. We're really honored that we can share what's been happening at the national and federal level through the National Autism Strategy, and also want to just reiterate that global, medical associations globally and here at home have come out with many position statements confirming that there is no conclusive evidence that using Tylenol during pregnancy causes autism or any other neurodevelopmental disorders. This is the statement that was issued by Health Canada. We had a meeting with Health Canada and Public Health Agency of Canada yesterday, and they reconfirmed that this is a national priority to support autistic people, and are supporting the community and using neuroaffirming language, and fighting against misinformation. Okay, so who are we? For those of you that don't know us, we're the Autism Alliance of Canada is a pan-Canadian network. We have a broad and diverse membership of autistic people, their families, folks that are supporting them, as well as clinicians, community organization leaders, decision makers, and many different organizations across the country. Our vision is powerful. It's a Canada where autistic people can exercise their full rights and realize their full potential. And our mission really focuses on how can we inform policy and practice using evidence, by bringing our members together, identifying priority issues that are really important to autistic people that can change their lives for the better, and how do we develop solutions and meaningful ways to address them and embed them within our national policy landscape. Our membership is quite broad and it reaches across the country from coast to coast. These are a few of the logos of our members. We're really grateful to have a wide membership, and we're really grateful to have very engaged members that contribute to projects, initiatives, and that can band together and advocate for issues that are really important to families and autistic people. Through our membership, we reach an estimated 850,000 autistic people and their families across Canada. And we have different membership tiers that some of them are accessible. So you can be, if you have lived experience, you can join the Autism Alliance for free, become part of our community, contribute, learn from us, we learn from you. And then we've got community members and organizational members. And you can go to our website for more information if you're interested in joining and being part of this collective movement. So what do? We've got 3 strategic priorities. We developed the shared policy agenda that really focuses on the National Autism Strategy. We also do our own health systems and policy research, as well as collaborate with partners across the country. Really grateful for the collaboration that we have with McMaster University and this group of folks here today. We're just so honored and privileged to be part of advancing science with you guys and bringing the lens of the lived experience to this important work. And then through our membership, we want to facilitate collective impact. So how can organizations do work that no one organization could accomplish together? How can we leverage resources together to make systems change? We serve as a bridge between families, clinicians, researchers, community organizations, and the federal government. That relationship has really advanced over the last several years. Government is listening. So joining the Alliance and becoming part of our initiatives is a new mechanism that we're building across the country so that the voices of families and autistic people can go directly to government to think of solutions to how to better our systems. We are a resource for evidence-based information, as we have been in the last several weeks. And we want to ensure that autistic people and families are at the center of shaping the research that we do, shaping the research that our partners do across the country, and generate that evidence that may inform policy. I'm going to turn it over to Jonathan now.
So, before we get into the strategy and where we are now today, I want to give a bit of a timeline of where we came from. It's always good to know the history of something to understand where we are today and why things are shaped the way they are today. So, and this is just one story. It's not the only story of how autism in this country has progressed and advanced and moved forward. But this is the story of, I'm going to pick it up in 2007. This is the year I always joke, well, it's true, that it's the year that Steve Jobs came up with the first iPhone. So if you think about it, we're many generations of iPhones down, but finally we have some action. But 2007, there was a Senate report in Ottawa. A few senators championed a report looking at autism, and what the title was Pay Now or Pay Later, Autism, Families in Crisis. It was really led by families, one family in particular on Parliament Hill, advocating, had a conversation, and then that led to more and more conversation about, hey, we should look at this as a country. And one of the biggest pieces of this report was that, hey, the federal government, the senators were saying, federal government, we need to have a framework, and that's a key word here, framework for autism, for federal leadership to make sure families aren't in crisis. And that was the language, that was how it was thought about. And we've evolved since, or in our thinking about this since 2007. But that was a report that really it started some momentum, both in the government, but also in the community, for where we are today. And it's shortly after this report, around the same time, different organizations came to government and said, hey, let's have some action on autism. And the government came back and said, hey, well, there's so many people talking to us. We don't know who's who. Can you come together in one voice? And what Deepa was saying, having a collective voice coming together. And that was the start of the organization that Deepa and I both are working at, Autism Alliance of Canada, back in the day, CASDA, was really the coming together of different organizations, those 5 originally. And now, as Deepa showed, we're over 1,000 members, to come as a collective voice, to go to the government and coordinate priorities, a shared commitment, and a course of commitment to making sure autism moved forward together as a country. So from 2007 to today, there's been different initiatives, different statements, different funding pieces, different programs that have been put together in the sector. I'm not going to go through them all, but really this is just to show you that there's been action steps along the way, sometimes steps backwards, and sometimes politics and elections sort of get in the way, as change in our democracy can be incremental at times, and that does happen. But these are just some of the highlights of what has happened since that point. And throughout those times, as the Alliance, what we've been doing is really to become a constructive policy generator, bringing people together to say, hey, what are helpful ways to move this forward? If it's a policy, if it's a program, if it's developing best practices. So here are just some examples on this page and the next slide about those. So top left corner there, housing through an autism lens, or bringing together member organizations and lived experience and families to say, hey, how do we think about housing? Ready will enable an employment program that we deliver across the country in over 30 communities right now. How do we look at employment supports? Policy compendium, thinking about policies in different sectors of society that are based on best practices from the community to say, hey, can we try this? Can we scale this program, this project? We convene international policy experts, bottom left there, about how different countries, here, Malta, the Netherlands, the US, other places, the UK, how do their policies work? And we have some research around that as well. Mental health, bring lived experience together. Just examples of some of the work we do at a national level, bringing partners together and convening them. Here again, some more, a lot of text on this page, but really look at the bold titles. From our summit, we have what finding out from across the country, what our provinces and their territories need to continue the conversation and move towards a strategy. How can we inform a strategy? International learnings. We have a wait list initiative. We have some work on autistic adults, specifically on mental health and supports, understanding their priorities as adults. So various different reports and outputs that really look to shape and inform policy moving forward. So fast forwarding, from 2007, when that initial report came out, December 2019. So this is, I guess, right before COVID. We can think about that as our timestamp. How the federal government did commit to creating a national autism strategy, and they finally heeded to that call after many years, decades of advocacy. And things got stalled for a bit. COVID came along and was a distraction or a distraction that needs to be dealt with, I should say, to some of this work. But there was a lot of push in the background to say, hey, we can't forget about people with disabilities. We can't forget about all these other pieces as we're dealing with this pandemic. How do we move this along? And then in March of 2023, so recall the report I brought up, a bill was passed by a senator, Senator Leo Housakos, who had a bill called an act respecting a federal framework on autism spectrum disorder. So really, he pulled back into this report to say, hey, we asked for this, And now I'm going to pass a bill, and this was passed by all parties across both the Senate and the House of Commons to say, hey, we need to have leadership in this. And this bill made the federal government at that time accountable to say, you got to come up with a framework. There's going to be measures. And 5 years from this day, you got to report back and say, what did you do in these areas? So that framework, this bill really pushes that forward. So we're in this period right now where this framework legislation has been passed, and there's a timeline for the federal government to then report on what they've done according to this autism framework. So where we are now, given that context, so I'm going to pass it back to Deepa.
Thanks, Jon. So for those of you that aren't familiar or haven't had the time in your busy lives to go and look at Canada's autism strategy, the strategy is organized around 5 national priorities, and these cover supports and services across the lifespan, economic inclusion, housing, data research, public awareness, and practical tools for families and providers. These priority areas were identified by a consultation with the autism community through various different mechanisms that the Public Health Agency of Canada had set up, as well as the Canadian Academy of Health Sciences, who did a report on the autism landscape in Canada. So when we look at the strategy, there's really 5 strengths that are worth highlighting. It's a bold and aspirational national vision. For the first time, we have Canada-wide commitments to inclusion and equity for autistic people. And as Jonathan mentioned, we have legislation that is going to hold the Minister of Health at that time accountable for impacting or for creating real change and putting legs under this strategy. Really importantly, it recognizes the essential role of lived experience. Autistic people, families, and caregivers were heard, and their voices and their priorities were embedded into the strategy by government. Third, very importantly, there's a commitment to work with provinces and territories, which is critical because most of the services and supports are delivered at the provincial level. And fourth, the strategy commits to integrating an autism lens into other large federal strategies. So the housing strategy, the mental health strategy, the dental strategy, which means that autism isn't siloed, but it's part of broader national planning. And then finally, there is a commitment to continuous improvement. The authors of the strategy, the team behind the strategy at the Public Health Agency of Canada, has been very forthcoming that this strategy is designed to evolve with regular reporting back to the community, and there's opportunities to adapt and refine it as time goes on and as needs are realized. So together, these strengths mean we're not starting from scratch, but we have this foundation to build on that is actually worth celebrating. But while the strategy has important strengths, we really want to be candid about its weaknesses. There's still a lot of work to be done. To the disappointment of most of our community, there was no dedicated funding to move initiatives in these priority areas forward. And without real investment, the vision risks staying on paper. And we know that families and autistic people cannot wait for more promises. They actually need actions that are tied to funding and resources. And while there's a commitment to work with provinces and territories, there were no clear incentives or clear policy levers outlined in the strategy that would bring provinces and territories to the table. And also, benchmarks are missing in terms of what does success look like for families? So if I'm a mom or an autistic person, the words on paper are great, but what does success look like in 5 years? How does my life change and how do we measure that? And so there's a lot of work to be done still around defining that success and those benchmarks. And then there is a lack of direct policy actions. The strategy sets direction, but doesn't actually spell out the concrete steps that are going to change the system. So while these gaps don't diminish the value of the strategy, there is political will. It does remind us that the advocacy must continue. We need to push for funding, clear accountability, and concrete actions to ensure that this strategy delivers real change to autistic people and our families.
So 1 year later, I'm not going to read this statement in full. We have it on our website. We published this, I guess this was last week, a year since that S203 framework bill was passed. And in that little web page, that blog page, we reflected on what needs to be done. And Deepa mentioned, and I'm just going to highlight that middle paragraph. Since the strategy's launched, what's been done so far in this first year? They've invested in creating the National Autism Network. So some folks might hear about that, and I'll talk about that a little more. And it's really for a pathway for community perspectives to reach decision makers. So it's great. It's an independent organization that us at the Alliance, along with the Cindy's Family Foundation, are setting up. So it can have its own 2 feet and play that independent role of guiding the Public Health Agency of Canada. So really an advisory role to government. And beyond that, 1 year later, we also reflected in this blog page what the community needs most right now is with this new government, political will, financial commitments, and financial commitment to back that political will, thinking about health and disability and autism specifically to move this forward, to make this bold vision, which is laid out in the strategy, to actually have outcomes that we can see concrete things different on the ground. So current activities, I did mention the National Autism Network. That's the organization that's being set up. Their first EGM where they're electing an independent board is actually at the end of this month. So I'm going to get to that in the next slide. Some of the other current activities we are involved in, we do have, I know this is an English webinar, and most of the work we're doing is in English. We do have Francophone town halls that we are trying to build capacity within the Francophone section, communities across Canada, to network and sort of build more collective voice within the Francophone communities in this country, because that's much needed as well. So I'm going to dive into the network a little bit. And the key priorities, as we did mention, is, this is a new organization that's sort of part of the strategy. So there's activities that deliver programs. There's going to be a convening of the provinces and territories. But this third part is to make sure that lived experience is part of this. And by that, I mean, there's advisory, an advisory body to the Public Health Agency of Canada, guided by autistic people and their caregivers. So that's going to be an important part of this. And as I said, it's about implementation. So how do you implement the 5 priorities of the strategy, giving them advice on that? So there's going to be opportunities to be part of that. So they are looking for members to join. If you're interested in giving advice in that way to the Public Health Agency of Canada or the strategy, they're opened now for membership. So what's needed now, and that's the conversation we want to have. This is what we put out in the 2025 federal election. We just lifted this page, and I'm going to talk about 2026 shortly. But right now, what we wanted and what we've been asking for is funding. So it's great, we can talk all we want, we could write things on paper, but until we actually see funding that actually supports the needs of autistic people and their families, and ways to that, and mechanisms to that, and having a pathway that shows a clear process. So we really want to move this forward, because there's been so much work in the research community, within the organization itself, within our leaders and community leaders in the community. We know what works, right? But it's finding the right windows and bringing the right people to the table to say, hey, we're all in agreement, we got to move this forward. And then for the federal government to say, hey, showing some leadership and resources to make it happen. So that's that implementation plan. Like that, it's possible. We just need that accountability, and then making sure that we actually have action on these things. So this year, we do have ways, and I invite everybody on the call to be part of these conversations, given whatever sphere of experience you have, from the research side, the clinical side, or the lived experience as family members. We do have budget recommendations, which I'm going to walk through really quickly. We also have a toolkit, which we've just sent out to members, and it was titled "Don't Shelve the Strategy," and to reach out to your local MPs and ways to, and different high level policy ideas that you can kind of have a conversation with. And we're supporting our members who are reaching out. They're copying us on these invites, and we're engaging in meetings with them if they need to really move the conversation forward. So the members of parliament, a lot of them new members of parliament after this election, can kind of think of issues they want to work on and come together and champion. So that's an important part of us as a community, being that collective voice, shifting the narrative, so people are hearing across the country consistent things from across the country from their constituents, so that priorities can be moved forward. So I'm going to walk through some of the federal election toolkit options, recommendations that we had. There were 6. I'm not going to go through them in detail, but just to give you a sense, and with each of these recommendations in this document, you can find it on our website. We can share these resources after as well. There's a recommendation and there's sort of a rationale or some background on it. This has been sent to the pre-budget finance committee, and they look at this for next year's budget. And so this is, first of all, to fund the strategy itself. So we have a national autism network. That's great. We're going to bring advice, but until somebody acts on that advice and somebody provides money to actually move these programs forward, it's great to receive advice, but what do we do beyond that? So really to think about the next step of what we can take. The second one, we know that Prime Minister Carney is very interested in housing Build Canada Homes, a big piece. CMHC now moving into Build Canada Homes, but thinking about let's just say affordable housing actually. But thinking about their mandate and commitment, now thinking about a lot of the resources and the capital that's going to be put in by the federal government. And the ask was really, can we move a target for housing for people with developmental disabilities for autism and modernize to think about how we do this in terms of the home accessibility tax credit and other ways that are made for autistic people to make sure that, for example, right now in the tax credit, you can have ramps put in and you can apply into the home accessibility tax credit, but sensory lighting, certain things with room, sound dampening pieces. So other things to make it more accessible under this housing priority, knowing that housing is such, there's going to be a lot of money put into housing, something that, we're hoping to be taken up. Here, there's a few tax ones. I'm not going to go into detail, but, looking at employment, looking at childcare expense, the DTC is a big one. DTC reform was part of this government's platform. So we're having some language around there to say, hey, can the reassessments be less for kids who are on the spectrum? Can we have it lifelong in some cases when that's appropriate? So thinking about some language on that and had talked to policymakers on that. So that's a conversation. Another one within the tax system, the caregiver credit for a lot of families that are of a low income. Making it refundable so that those families can apply for this credit and it'll actually be relevant to those who need it the most. And the last one I'm going to bring here, because of our audience here, really thinking about if there could be a way to train primary care community practitioners to diagnose autism and target investments for health practitioners. So these are just some, this is around capacity building for health and human resources. So these are ones we have worked with over the past couple of years, just to think of knowing where this government is thinking, knowing where the levers are that are possible things that can be taken up to say, hey, we can move this forward. So a lot of the work, I hope you can sense, even with these 6 recommendations, and our work is, we're usually ahead of the government, pushing a few things forward and hoping some of them stick. And having those conversations, make sure we're staying relevant to the community, but staying relevant to the political and policy context that we have. The last one I'm going to go into, this is sort of policy nerd talk on paper right here, but really bilateral agreements. Deepa talked about it. In the end, a lot of the felt impact will be at the provincial and territorial level. So thinking about what the federal government can do to incentivize provinces and territories to take action. And right now there's a political window for this to say, as a federal government's trying to work sort of the intergovernmental relations with the PTs and how that's going to look like in terms of trade, but thinking about other agreements that can be set up. So we're developing, and the word's really multilateral framework agreement, just means by sort of the relations, in terms of the health transfers or different things like that, where we can say, hey, on wait times and diagnosis and services, can we have a structure where there's some kind of funding agreement to say with the provinces and territories to move things forward as a country. So those are conversations we're having with at the PT level, the provincial territorial level, and also at the federal level right now. So happy to kind of talk about that more if that's of interest. And Deepa, I'll turn it back to you.
Thanks, Jonathan. I'll conclude with our call to action, which has been our call to action for many years. The strategy is the beginning, but it's not the end. We know this work is exhausting, and we're really grateful for our members who are staying at that table, who are speaking out, reaching out to local government, their MPs, talking about their needs and solutions. And we've got to all push for accountability without, big P political will and fundings and timelines and real benchmarks. We don't want that change to stay on paper instead of being felt in daily life. And the National Autism Network and the Alliance are platforms where you can get involved to stay in that conversation and help move this forward. Thank you.
And we'll close there. If you have questions, there's our contact email, and we'll open it up.
Thank you, Jonathan, and thank you, Deepa. There was mention during your presentation about both kind of politics and policy generation. As an organization that's gone through sort of different iterations as a group, doing many projects in different priority areas, and of course, living on through different governments, are there some reflections that you both might have about what you've learned over the years in terms of what works, quote unquote, and what doesn't? I think a general question around, what might lead to success in terms of your policy work and generation.
It's a great question. I think I don't want to oversimplify it, but I also don't want to not highlight this. I think the success of this collective movement is the passion behind the families and autistic self-advocates and organizations that are working on the ground to make real change. And the most success we've seen is when people speak up, politicians and policymakers listen, and there's a real power in that. And so I think that's the most important lesson that I take out of all the work that we do, is that we need our members and we need people to stay engaged in the conversation to get the attention of our decision makers at the national level, to say this is a priority, this matters to Canadians, and then finding the right language that is inclusive and empowering to ensure that those messages are neuro-affirming, strength-based, but also address the real challenges that people face day to day. I also think another really important lesson, as we've worked with different governments in this time span, is good policies is good policy, and it can be adopted by any political party, regardless of their ideology or their political will or their, we've got so much sensationalism around politics these days, but I think good policy sort of crosses all party lines. And if we can develop policy that makes sense and actually aligns with the political levers that are available to us and aligned with the priorities of autistic people, it resonates with decision makers.
Yeah, only other thing, and that's exactly what it is. I would just say it's what Deepa's saying, that our North Star, right? What are we doing this for? And thinking about that, and it may be framed very differently depending on the political values of that era, but knowing what we're trying to go for at the very end, just to go for that. And the other thing, change moves at the speed of trust. So us, Deepa and I, spending a lot of time building these relationships with policymakers, talking with just various people, and just saying, hey, we're trying to move something together. We're all aligned on that North Star, and getting that buy-in from people. That's important.
And then I think the other only thing I can add to that too is that data and numbers really, really matter. And in Canada, it is very heartening to see that our government and our people in decision-making roles do respond to data, numbers, evidence. And so, most of the people on this call are most likely families or researchers. So when we come together and can work together across projects to generate that evidence, that it comes not only from one study or one province, but across the country, or a population-based study, it really can shape and shift hearts and minds at the political level to invest resources or to think about how to create better systems.
Deepa, I'm going to take that as a great segue into our next question. You mentioned numbers, you mentioned data. So the next question, I think, has that angle to it. It reads, for the discussions around the federal government toolkit, can you speak to how the quantitative targets were developed? For example, government to provide 5 million over 4 years, or increase commitment of housing from 2075 to 10,000, etc.
Yeah, that is a great question. A lot of those numbers came from, forecasting projections, which we worked on with some policy advisors, and using numbers that were currently used for different sectors, and then thinking about what was realistic within budgets that are being created right now at the national level, which are really about cost savings and cost effectiveness. I should probably have a really much more detailed answer to this, but it was a broad question, and we're happy to answer follow-up questions for those sort of items and how they were developed after via email. But Jon, do you have stuff to add?
Sure. Yeah, it really different numbers kind of came from different conversations. So some of it is knowing what's feasible and what's possible. Like there's times when we want to ask for the moon, but knowing that, okay, this will actually make it in a platform. This would actually make it in and be elevated in a briefing note, and knowing the realities. So there's different. I guess I would say in advocacy and in conversations, there's different. You push different levels in different ways. So a public voice, at a deputy minister level, at a minister level, and at with working with bureaucrats, and sometimes you can be more bold in certain times than others. So it's sort of a measured approach, and those numbers will flex over time. And if you look over our toolkits over the years, it does change, and we're trying to make we want to make it's always a bit of a negotiation to say, hey, we think this makes sense given what your scope and your climate of where you're existing.
And I can be a bit more nuanced on one of those recommendations. So we recommended that the government creates a fund to train practitioners, so that that's based off of a program that's currently being done across the country, led by Dr. Melanie Penner. Many of you know that. Some of you are on that project and that work, and looking at what does it cost to run that program? How many more practitioners can it change? What does it cost to run it at a site? And then thinking about how do we project that so that we can run more sites across the country within a reasonable number for that budget. And that's how we got the $15 million. So there are real numbers behind what does it take to run that program? And then what does it take to scale that program in other places across the country?
I'm going to segue to another sort of data-related question. Since all of the provinces are in charge of tracking their own data in terms of what programs autistic children and adults are involved in, and it's impossible to compare which provinces are doing better than others, since what few public data sets are available don't necessarily align with each other, what is being done with regard to standardizing data across provinces and perhaps making it even open access so the public can see what's happening? Ooh. Easy question, right?
Question. That's the dream. I can say there's several initiatives happening across the country that are thinking about how do we standardize these measures, and also how do we make this data more transparent to families and to autistic people so they can look at it and see it. And I think there's innovative ways to go about it. We at the Alliance are working on several things, AI initiatives that might help actually collecting the data from the people because it's our data. We also work on how do we access population level data sets to illuminate some of the challenges in service use for autistic people across the country. We have a national wait times initiative. The entire purpose of that initiative was to bring decision makers from big sites across the country to start to talk about what goes into measuring wait times for diagnosis, what goes into measuring wait times for services, what are some of the barriers to reporting that data, to collecting that data, what are some of the inconsistencies, and how can we develop common benchmarks for even that indicator to see how long kids are waiting to get diagnosed. It's, as the person mentioned, incredibly inconsistent across the country due to so many different reasons that are not the fault of the people who are collecting the data, but how the systems or the organizations or the institutions that they work at choose to sort of define and collect that data. We're happy to share the work of that project. It's coming out. We've shared it before at Summit, but happy to share some of what we found and how we're thinking about creating those common indicators for some of these benchmarks that are really important to families. I don't know
One
if
thing
that
on that one is the bilateral agreements we're thinking about. It's not about just throwing more money at the problem, because wait lists is a problem, and wait times for diagnosis services, but using that as an opportunity when we try to help them move the provinces and territories and the federal government, that's what them I'm talking about, kind of talk to each other to say, hey, let's use this as an opportunity to transform the system a bit, modernize it a bit, to say, And you guys, part of this process over a couple of years is not just we're going to give you money, make sure your wait times go down, but all agree on what a wait time is and have a common way to think about it. And so really at the systems level to do some transformation, as you're giving a bit of money, but really the gold nugget is really if we can transform and have better definitions that are shared. Yeah.
And importantly, so many people across the country are working on this in their own institutions. And so what we can do is bring those folks together to have those conversations and learn lessons from each other of how are you tracking it, what's working, what's not working, and again, what are those barriers to providing a transparent system for families and for autistic people who are waiting for this information.
Great, thank you both. Next question. How can you guarantee accountability of the network to the autistic community? Advisory boards can often be performative.
Something we've always struggled with, and something, as a strategy was developed and, publicly, privately with the policymakers, transparency is so important in this process. We ask for, when you're developing this, make sure there's a RFP, it's educated independently as you're building this, make sure all the processes there's no conflicts of interest. So we're very much interested in making sure that happens. Advisory boards, they're set up everywhere as the question is asking, and the person who's receiving that advice can take it or may not take it, right? So that is a possibility, and that's why at the Alliance we're very much trying to, the network is setting up advisory, and that's great. We need that. But at the Alliance, we need to continue to put pressure on the issue in general at the big political level so that that advice is taken up. So there's sort of different roles everybody will play as this advisory board is being set up, and to make sure it's not tokenized by the government, and make sure it is transparent and it is being, though the advice given is public and shown, and that their processes are clean and at the political will level, we continue to push as a larger community.
I think also the important piece here is like that we're not government, the network is not government, right? And so if we're the accountability that we want to hold for our members is transparent processes and getting involved with the work, getting involved in those advisory boards, being inclusive as much as we can, having the right values guide that work, and having autistic people guide that, having autistic leadership on our boards, having autistic leadership in our teams, having lived experience, families, moms, dads, caregivers involved in this work so that we can all hold each other to account for the processes that we have within our control. I don't know if that answers the question, but the network and the Alliance are guided by fundamental values and principles that are transparent, and we're accountable for the processes that we engage in, but we can't guarantee, that how to hold the government accountable to the advice that's given to the network is, a bit beyond what I think we can do. But through advocacy and through folks speaking up, that's sort of how civil society holds government accountable. I don't know if that answers the question.
We do have a couple more questions to get through. So the next one is, thank you for your presentation. Very helpful points about leveraging policy windows. I agree on that. This person would be curious to know whether and how you're working with Indigenous nations and communities to include them in these important conversations.
Yeah, absolutely. Jon, do you want to?
Sure. So over the years, we've developed really good relationships and with the Anishinaabe Nation, so covering most of Ontario, one of the biggest ones, and other groups as well, and other individuals. So we have been working closely. Over the years, we've been calling for a distinct, separate approach for an autism strategy. That there's a federal strategy, but how do you have a distinct approach for Indigenous groups and Indigenous, broad strokes, but really First Nations, Métis, Inuit, and thinking about those as slightly different. But I think that's what we've been calling for, and what government did over the past 5 years is sort of engage with a few different Indigenous groups and organizations. Our response is, and hearing from our Indigenous members, hey, we were never consulted. So it didn't seem to be as comprehensive as it needed to be, is sort of my first take on it. The second piece of engaging is, they are having an interest in holding an Indigenous-led autism summit or some sort of event, so really further that engagement. That might have been because of the conversation that we had in the past. So there is a focus on that. And when the network was created, I wanted to make sure there was an Indigenous council put in place, and just remember we're embedded throughout. So that is an emphasis that we want to make sure, because there are different policies and guidelines that kind of and jurisdictional sort of challenges that unique challenges that are faced. So we want to make sure that there's a special focus on that. When we think about equity, you move a movement forward. The ones that are left behind are the ones that are not at the table usually. So that's an important thing we want to keep in mind all the time.
Yeah, I think it's really about bringing Indigenous leaders so that they can lead in this space, and ensuring that the folks that we're having conversations with are having independent conversations with them as well. And the network has its Indigenous Advisory Council, and Indigenous leaders are really very importantly leading that work.
I will move to another question. Are there other autism strategies from other nations internationally that were used to inform Canada's framework? And are there learnings that could be taken from other countries that might have begun or started their autism strategies before us to inform what's happening here?
Yeah, that's such an excellent question. And we've done a lot of work in this area. So we know that the UK has an excellent strategy, Australia, Malta. There's work that was being done in the US. That was really good. Why did I say that? But anyways, it was. And then we've got, so there's countries that are definitely ahead of us in this, and that information has been translated into briefs, the lessons learned, available on our website as well if you're interested in more of those details. But, I think one of the fundamental issues in translating strategies from other countries is we have fundamentally different healthcare systems, but there's still lessons that can be learned. And some of the success that's the countries that have seen change on the ground, they have got big political will, and they've got funding, and they've got benchmarks. So the NHS has benchmarks for what is an acceptable wait time, what is an acceptable time to services, and how much money they're going to invest in system transformation. And so those are some of the components that we're sort of missing in our strategy and waiting for. And then the other element of success has been that guiding and centering of autistic people and their families in that policy development process, which Canada really listened to and did implement within their process.
Only thing that, we're learning from a lot of other countries, and we see what other countries are doing well. There are some countries that are behind us, and many, I'm thinking outside of the Commonwealth, like even like other countries around the world. And I think there's opportunity there. And Deep and we've been working, kind of under the auspices of the UNCRPD and some of the work there to say, how do we create sort of international groups, international autism learning policy group, and just to understand where people are, and we're along the spectrum, right? We know there's that we can help others and learn from others, and I think those are always good conversations to have.
The other piece I want to say is the strategies that take a more wholesome approach to supporting the holistic individual. So it's not just about health or healthcare, but also touch on housing, employment, education, so that they span those different sectors and are not just siloed into health. That's where countries are seeing success. Where we're actually investing into the socioeconomic factors that affect development and health and well-being, and bringing those lessons into the strategy here at home.
All right, Deepa, you mentioned a holistic approach. I think this might tie in with another question we have, specifically whether we consider geriatric populations in our strategy. But I think I might, off the cuff here, expand the question maybe around taking a lifespan approach within the strategy. So kind of just expanding on that a little bit.
Absolutely. The strategy aims to take a lifespan approach. I think for it to actually impact all of the lifespan, there needs to be measures and actions in the implementation phase that look at how do we support autistic individuals, not only in childhood, not only in adulthood, but very importantly in the later phases of life. but absolutely the intention of the strategy is to take that lifespan approach. Jonathan, do you want to
No,
add?
not much to add. I think that's exactly what it is. There's so many cross-sectoral things, and we have a lifespan. What we think about housing, usually that's a big place. Social services, health. How does that work in older adults? And there's a gap. There's a big gap there, and lots of work needs to be done pretty urgently to make sure we're on top of things. Yeah.
I'm going to maybe ask both of you to answer this final question. In terms of future vision, if you can imagine the impact of this strategy 10 years from now, what would you hope to see?
I would hope to see higher employment rates for autistic people. I would hope to see workplaces where it's very commonplace and society's norm is to be able to say, hey, I'm autistic and these are the accommodations that I need. And that is not met with, questions. That is just kind of our commonplace. I'd like autistic kids to be welcomed and supported in our education system, as well as all children. But we're speaking about our population at the moment, and I'd like to see resources being put into educational assistance that can support the neurodiversity in the classroom. I'd like to see that's what success looks like. We would like to see wait times that are not 18 months to 4 years for life-affirming diagnosis for kids. We'd like those wait times to come down to a couple of months, a few weeks, 8 weeks. And we'd like to see more easier access to supports and services across the country, so that it's not one province you have access to all of these things and in one province you don't. And the other thing I think that would look like, well, there's so many things that would look like successful, but navigation for our complex systems. So more supports for families and autistic people to navigate the complexity of our systems and navigate things like disability tax credits, navigate where do I get the services, from who and how. And so, more investments into or more solutions around easier navigation for families.
It's a good question. I think Deepa answered the 10-year. I'm going to go to the 20 or 50 year. I would like to see that there's no need for a strategy. That the issues in equity are solved to the point where it's folded into something broader, into the healthcare system, the social care system. If we can get to that stage, then it's a win.
I like ending on that optimistic note, John. So that's perfect.
I do too.